order. Ursula, would you please lead us in the pledge tonight?
I pledge allegiance to
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Will, you still have to remind me to turn on the microphone, okay? That's your job.
Can I use a piece of paper?
Okay, first thing on the agenda is the approval of the minutes. I'm assuming everybody had a chance to look at those. Are there any changes to them, corrections?
I would move to approve as presented.
Thank you, Lance. Is there a second? Thank you, Will. It's been moved and seconded. All in favor of approving the minutes, please say aye.
Aye.
Any opposed, nay? Oh, thank you for that. Rebecca?
Aye.
Thank you. It has been approved unanimously, so let's move on to the next thing on the agenda, the monthly financial reports. This is information only. Gwen?
Okay, the budget report, is closing out last year. So it's, look, in the third column of numbers, basically tells you the budget, how much was spent, and what the balance was in the budget. You can see in the general fund, we spent the budget. There were some budget balances remaining in some of the other funds, which is not unusual. You can see one set of red numbers there, and that's the elementary retirement fund, and I overspent it again. And it's just hard to estimate retirement costs on people that we hire throughout the year. And this past year, we got CRF money, and we hired people with it, and we were able to take their retirement costs out of the retirement fund, so that's what I did. And that'll be an odd exception that's getting smaller, though. Not sure it's even gonna be material, but we'll find out. So the top, set of numbers are budgeted funds, so they all garner tax revenue. So if you look to the far right, the very last column, you can see the percentage of revenue that came into those, and I mean, that's impressive, I have to say. Kalispell School District taxpayers pay their taxes, and that's cool. So then the second set of numbers are cash funds. So the budget is limited, the expenditures are limited by the cash, but, you know, I estimate what I think the budget will be, and there's a couple of red numbers there, and I just was a little short on the cost for running the print shop and self-insurance, but they were pretty close, and there's no, you know, there's no penalty for that because they're cash funds, but I always look in my crystal ball and see if I can figure out what that budget might be for next year. So that's the elementary. Scrolling down to the next page, same thing on the high school side. You don't see any negative numbers in the budget balances, so that's good. And then on the far right-hand side, you see some really high tax collection percentages, which again is awesome. And then down below, the cash funds, I was a little bit off on my estimate for school foods and traffic education. And we revamped the traffic ed program, so the expenditures were a little different than they've been. Yes.
When they're over, is that because the person pays like the whole year instead of 6 months at a time?
Well,
Or how does it mean, like 177 is like a lot over?
yeah, and that's the technology fund. Yeah, there's probably some, should have been school technology. Yeah.
That would be
It's
state,
interesting, because
that'd be state revenue, wouldn't it?
it doesn't even get any tax revenue. But I estimated, yeah, that revenue is mostly E-rate, which I really don't have much luck estimating.
So it's just.
Yeah, so that's an anomaly there for sure. Your only question?
Yeah, that was it.
Perfect. Okay, so that closes out last year. Well, we're gonna look at one more document that finishes up closing last year, and that's a cash report. And so, we're mostly looking at the fourth row there that has year-end cash balances. And so if you look at the general fund, there's a little over $2 million in there, and we use that cash to fill the reserves. We have a 10% reserve of our next year's budget, and we're going to use exactly that to fill the reserve. And then, in the next column where you see the blue highlights, if we're moving money into the interlocal agreement fund, I put the amount here. And that's gonna be one of our action items a little bit later tonight. And then on the far right-hand side, if we're not putting it in reserve and we're not transferring it to the interlocal agreement, it's cash that carries over into the next year's budget, right? And so kind of an anomaly there is your bus depreciation. We didn't purchase any buses, we're in the process of doing that now. And so the entire amount is reappropriated. And, that's a wise thing to do because you never know when you have to buy a bus. So you don't set it in reserves, you just cash reappropriate, make it all available. So then transportation, you see some interlocal agreement transfers. The reserve is full in transportation, and then a transfer to interlocal agreement. Tuition, not holding anything in reserve there. We're gonna move some into the interlocal agreement fund and then carry over the $417 difference. And same thing with adult debt. We're gonna fill our reserves. And full reserves are critical when you're preparing to sell bonds. And they do look back previous years to say, okay, where are your reserves always full? So we want to have them full. And no, we do not do. If you scroll down, same information on the high school side. And you don't see any negative numbers in the cash balance. And that's good because you can't actually by law have negative numbers at your end, right? Okay, so that's the cash piece. And then just kind of one quick final report on the APS insurance financials. So this financial report is a little bit skewed because, again, we can't have a negative balance. So we move money out of the interlocal agreement fund into this account, and then July 1, we move it back. But if you take the $350,000 that's in First Interstate, those are our clearing accounts, right? That's where we pay our claims from. Scroll down, Kelly, to the next highlighted number, the $554,000. That was the loan from the interlocal agreement fund. So the difference between those two tells you we had a $200,000 shortfall in last year's health insurance fund. That will roll over into next year, and hopefully we'll make that up in an increase in premiums or a decrease in healthcare costs. So that's where we landed on the health insurance, which was not bad. We'd like to get to zero, but we're getting close. So those are all the reports, and they were for information only. Did anybody have any questions on those before we go on the actual getting on to the next year? And the first document is the interlocal agreement fund. And so it's an action item, and the interlocal agreement fund is on the high school side. So this is a district-wide action. And we have an agreement between the elementary and the high school that allows us to transfer money into the interlocal agreement fund at year end. And so attached to that, if you scroll down, is all of the transactions in the interlocal agreement fund since its inception. And then if you get near the bottom, there's going to be a full page that is 20, right there, 2021. So that's last year. So we have a little bit of investment earnings. The second set of numbers is there where we repaid the health insurance loan that we had, that we made at the end of the year, the previous year. And then last year, we contributed an additional $700,000 to the health insurance plan, and that came out of the interlocal agreement fund. And then moving down, the board had approved, there we go. The board had approved Any budget shortfalls in the general fund could be taken out of the interlocal agreement fund. We approved that last year at this time, and we did have a shortfall on the elementary general fund of about $348,000. So we took that out of the interlocal agreement fund to balance that. The first set of numbers, kind of in the middle, are what we call the set-asides, and we've just made agreements. Sometimes we make an agreement at this time, that we're going to set aside a certain amount of money for certain things, curriculum, for things that we don't buy every year, but we need to amass a certain amount of money, so when those things need to be replaced, we have money sitting in our savings account. And so we have some curriculum set aside, and then on the far right-hand side, we have some curriculum expenditures on the high school. So, so then the set-aside is going to be reduced by those expenditures and establish the new set-aside that we're going to look at here in a minute. So we have the turf, track, and gym floor set-asides on the elementary side and the high school side, and we refinished the floor at LEC. And then we paid for the property on which we plan to build a new transportation and maintenance department. So you can see transactions on both the elementary side and the high school side, earnest money, and so on. Then there's the FHS grand piano, and then there's the health insurance loan that we needed to get our funds to zero. And then you'll see that money flow back in the next month. And then in the yellow highlights, that's what I'm asking you to approve, but this motion is for those transfers. And then if you scroll on down, this is the beginning of this for next year of the interlocal agreement fund. You see the health insurance loan comes back in. We have our set-asides in curriculum, turf, track. The flathead lockers were approved to be paid out of interlocal agreement. They did not arrive and were not paid for by June 30th, so they're going to come out of next year. But you approved that. Remember, we bring these purchases to you for approval. The turf, track, set-aside, we're adding $50,000 a year to that on the elementary side, and we're adding $100,000 a year to the set-aside on the high school side, so that we have money to replace the turf when that happens and keep gym floors refinished in the meantime. So if you scroll down just a little bit more, Kelly, so right there, $2.6 million in the interlocal agreement fund that is not already spoken for. Now, those earmarks are something that we've established over time, but all it takes is one board motion to make changes to this. Those are just set-asides we've agreed on. So what I'm looking for tonight is a motion to approve those transfers as presented. And we need to have an elementary motion. Oh, yes, because they're coming out of elementary funds going into the interlocal agreement fund. So we need an elementary motion and a high school motion.
So any questions from the board members? Ursula?
Nope, I don't have a question. I'll just make a motion when you're ready.
Okay.
Gwen, can you, the transfers to the interlocal agreement are larger than in prior years. Can you speak to that a little bit?
It's 1.8 million total. Is it larger than prior years? So Kelly, let's just look at the very first year. Scroll back to the top. So that year we transferred $800,000. It very, yeah, it could be. Scroll on down. I think the transfers out of the high school general fund is definitely higher than it normally is, because we often don't have a whole lot to transfer. Although right there is the general fund, 262 and 93. The transportation transfers have been higher. So that year, $3.7 million. That's $1.5 million that year. Sorry, let's scroll down there one more time so I can look at art.
Well, 1920 was a large year.
Yeah, so there's $1.1 million, 1, 2, 3, 4, 5, 6, 7, 8, 9. Yeah, there's a couple million that year. So that was probably the highest, and this is, getting close to. remember, we levied 2 additional mills on the elementary side and the high school side for our building project, with the idea that that money would flow into the interlocal agreement, and we would amass over a period of 3 years money to. So I would say the transportation is higher than it normally is, or normally has been. So scroll down just a little bit, the adult ed is kind of, is about right where it's been. And adult ed on the high school side might be a little higher. We really, obviously, last year being a COVID year, we really didn't do anything with adult ed. In some years, we do have a full program run by the folks at Flathead. But yeah, the transportation is probably the one, Jack, that's the highest. And we did that purposefully.
Thank you.
Yeah.
Any other questions from the board? Okay, this is an action item, and so there is public comment allowed on this particular topic. If you have a comment to make, there is a sign-up sheet on the front desk up there. And is there anybody here who wants to comment on this? Okay.
I didn't get that. Could you try again? That was a no.
Okay, so no public comment. So, are you will?
I move that we approve the elementary fund transfer as presented into the interlocal agreement fund. Second.
Okay, it's been moved and seconded. All those in favor, please say aye.
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 Any opposed, say nay. It's been approved unanimously. And then we will do the, the high school motion. Any, Steve, Will?
I'll move to approve the high school. Interlocal.
Thank you, Will. Is there a second? Mark said that. Thank you, Mark. Okay, it's been moved and seconded. All in favor to approve the high school fund, say aye.
Aye.
Any
Aye.
opposed? It has been approved unanimously. Let's move on to the next one.
So Kelly, we're gonna open the final budget adoption, and then we're gonna circle back to the elementary general fund. I'm gonna share some information with you, and then you'll know what you wanna do on the elementary general fund. So, these documents I also gave to you in a handout, just in case you wanna write something on it, or you wanna walk away with some information in your hand. Tonight, I'm asking you to approve a $105 million budget, so obviously not something we take lightly. We worked on this budget since October. We had a fairly thorough review at the June board meeting and another one at the select board meeting, and so I feel like we've covered it well, but feel free to ask questions, and we're just gonna kind of hit the high points here. So, Kelly, if you scroll down first to the, keep going, we're gonna go past those. So the taxable values have come in, and we've had some nice increases. So this is the elementary. We had $9 million increase on the elementary taxable values. So we went from $62,000 per mill to 71, so right at 10,000 per mill. And then if you scroll down a little bit, Kelly will touch on. So at the bottom of this report, it tells you how much of the taxable value increase was new construction and how much was part of the reassessment, or the revaluation of property, right? And so only 9% was new construction. But keep in mind, this is 18-19 information. They're 2 years behind, right? Because you can't assess and levy and, in a short period of time. This takes time. And those reassessments are based on sales. So if you've lived in your home forever and it's time to reassess your home, they look at other like homes and what they sold for. And that becomes your new assessment. so we'll see some large increases over the next couple of years based on what happened in the valley in the last 18 months, right? So, but keep in mind, this is 18-19, and so the bulk of this is reassessment to people's property, and that's going to be important here in a few minutes. So the next page is the high school, and oops, back up just so you can see my written numbers. So we had a nice increase, 22 million increase in the taxable values, so 22,000 per mil, a 15.8% increase in taxable value. And we usually are around the 3-4%. So I mean, this is like awesome, and it'll get even better over the next couple of years. And then the final, and so same thing near the bottom on this, 10% of this was new property, and so 90% is people that paid taxes to us last year, right? So keeping that in mind. And then the third page is, this has to do with the debt service, that little piece of property that was in Kalispell when we built Glacier High School and is in Big Fork now. So when we did our new high school bonds, they were not assessed, and so we have to treat that group of people a little differently. And it's not a large amount, so it's not really germane to the decisions we're going to make tonight. But so next up then, and you've seen this document before, so these are all of the funds. You see elementary first, similar to the budget report, the top half of these funds are all budgeted funds, so they garner taxes. So you see the funds, you see the proposed budget, which is what you're going to be adopting tonight. 2.9% increase in budgeted funds on the elementary. You see the reserves, and you saw earlier that those come out of the cash balances. Then the property tax assessment, so that's what will be assessed to the property owners in our district. The next column is the 2021 mills, so last year's mills. And then 21-22 mills, so the mills that we're going to levy next year. And then to the far right, you see the difference, and all of them are decreases. And the main reason they're decreases is because of the increases in taxable value. The elementary general fund, that decrease is partly because our budget dropped because of our A and B decrease, right? And the others are, are minimal. But there's 24 mills there that we're going to decrease. And then we're going to talk about that a little bit more here in a minute. So the bottom group of numbers, again, are cash funds. I increased the federal programs cash by $2 million because we've got ESSER 2 coming in there. I've beefed up self-insurance so that we won't, so we'll have it covered. But really, just an estimate of what we think the revenues might be in those cash funds. And so if you scroll down to the next page, Kelly, for the high school, same thing. Proposed budget, that's what you're approving tonight. The reserves, the property tax level, last year's mills, this year's mills, and again, differences. And so quite a few, or all reductions in mills. And then the bottom piece is the food service, all the cash funds, miscellaneous federal programs, traffic ed, those sorts of things. And there's your bottom line, $105 million annual budget for next year. So now if you go to the next page, Kelly, blank page, sorry about that. So again, at the top of this, those are your mill values from last year. So that's what one mill will garner. And then the new mill values and the differences, the $9,000 and the $20,000 difference. And then there are all those mill reductions. So if you were a member of our district last year, you would, and then this year, you would actually see your taxes go down based on those mill changes. And so I talked to the Department of Revenue, and because there are new assessments, what percentage increase are there on the assessment? If we levied the exact same mills from year to year, your taxes would increase just based on the fact that the value of your home went up 12%, right? And so our goal is to try to keep our mills fairly level or on a slight incline. You don't want your mills to go up and down and up and down. So again, what I'm proposing is that we capture some of those mills, but not the entire amount, because I would actually like to see homeowners' taxes not change from last year to this year. I don't want to see them go down, and I also don't want to see them go up unnecessarily. So I'm proposing that we capture 88%. So if you scroll up a little bit more, Kelly, and the reason I think that we should do that is because we need a transportation maintenance facility. We have to move. We don't own the facility that we're residing in, and we've been asked to move. What I'm proposing is that we capture the 21.2 mills on the elementary side in the transportation fund, and that we capture the 6.72 mills on the high school side in the transportation fund. The proposed cost of the transportation facility is $4.9 million. And if we make these mill adjustments, we'll collect $2.6 million from those recaptured mills. And our taxpayers' mills and taxes should stay fairly level. Now, some people had less than a 12%, so they're gonna get a break. Some people had more, but according to the Department of Revenue, the average was 12%. So, and then we have money in the interlocal agreement fund for the purpose that went in there out of the transportation fund, and we think it makes sense to earmark that for the transportation maintenance facility. So there's $1.8 million. I also budgeted 2 mills in the elementary and the high school already in the transportation budget. So that's, $500,000. And that will get us right to what we need for this facility. And so, part of the motion tonight, if you're okay with recapturing those mills, part of the motion will be for you to give us authorization to go ahead and move forward with that facility. So questions about this scenario or this proposal?
Glenn, I've got a question.
Sure.
So this 4.9, just this year, or is that total cost?
That's the total cost. We've been working on that for the past year, and so that's an estimate from the architects and engineers. And the point that we're at now is they need permission to move ahead or not. And obviously, this will have to go through a bidding process and the cost of materials. We're looking to begin building, next spring. So, in January, we'll go out for bids, but this is their best guess.
So, has that been building up over time, or we just grabbed 4.9 million?
Well, the top line there, the 2.6, I'm proposing that we levy next year. But remember, we're borrowing mills from other places where we don't need them. So it will not cause an increase in taxes. And the timing is perfect because here we are ready to build this. We were going to just a couple of years at a time, right? And over 3 or 4 years, try to garner those revenues. And then the money that's been going into the interlocal agreement fund, it's been going in there for 5 or 6 years. And at that time, we didn't know we were going to be building a facility, but now that we are, it seems to make sense to capture money that came from the transportation fund and use it for this facility. We wouldn't have to. When it goes in the interlocal agreement fund, it loses its identity. You can use it however you want, right? But it makes sense, right, Will?
Sure.
And then we had agreed that we would budget 2 mills each year for the next 3 years to try to get. And we didn't think it would come in. My estimate for the building was $3 million, but see, I'm not very good at estimating because it was $5 million. I just about fell off my chair. So we were geared toward, at the end of 3 years, we'd be right at the $3 million, and it doesn't look like that's what's going to happen here. So this is an opportunity to recapture some mills and build the facility and not have to borrow money, and that needs to be repaid over time in the transportation department, and go ahead and move forward with our project. Yes, there's one.
The recapturing the mills, that's a 1-year thing then? And then the next year, we could figure out kind of how to readjust things again?
Yes, and so, good point, Ursula. So tonight, you see a recommendation to not levy the elementary general fund levy that we just got approved. Because a year from now, we're gonna have 20 mills available, and it's 7.75 mills to impose that levy. And so I'm saying we shouldn't do it this year, and then next year, we can impose it and see still a 14 mil decrease. And we're gonna get a little bit of a roller coaster going here for a couple of years, but, I mean, with the federal dollars that we had, you know, I mean, we're controlling it as much as we can, but we don't want these huge highs and lows. And then on the high school side, if we were to run the levy that we need in the high school in the spring, I believe that we could cover it without an increase in their taxes. So, this is a good year to one time capture those mills, and then a year from now, let them go and be able to levy what we need to get us almost to maximum on the high school side, and then actually see a decrease on the elementary side.
Jack, go ahead.
Thank you. Will, going back to your question on the second line where it talks about the amount of money coming out of the elementary interlocal agreement and high school interlocal agreement from prior year contributions. So back in 2011, when we set up the interlocal agreement fund, though it wasn't a requirement, we kind of made it a board policy that we would track the money going in so that we knew where it should go going out. So in 2011-12, there's no transportation money that went in, but in 2012-13, we started putting transportation money in. So it's just an accumulation, $175,000 that year, $125,000. And we didn't know what the money would be used for at the time. We just thought it would be prudent to track it in order to say that we've got this is what it should really be allocated for, and let's be strict about it so we don't, even though we can spend it in any way, shape, or form, we just thought at the time we need to stay with that model. And right now, it's paying off by doing that. And likewise with, some of the discussions we've had on reserving money in the interlocal agreement, like for turf replacement or gym floor replacement and things like that. We're kind of making a long-term commitment to do that and to fund that each year. And we may continually need to have conversations to reaffirm that, or because if we don't put money in there each year, then the money won't be there to do it, and all of a sudden, we're gonna be facing deferred maintenance projects that are not gonna get paid for, because we don't have the money unless we cut something out of some other budget. So the interlocal agreement, we tried to put some strong sidebars in it for all the different things in order to respect the origination of the money, and then respect the fact that if we do have money there, and it's not needed for operations, do we have some non-recurring periodic expenditures that should be allocated for?
Any questions about that proposal for the recapturing of mills? Okay, so we're gonna cover a little bit more information, then we're gonna circle back and, make some motions. So this is a 4-year projection for the general fund. And in the first column there, that's this next school year. And our general fund will be operating in the deficit. $1 million deficit on the elementary side and right at $1 million on the high school side. But if you look below that, you can see that we have ESSER funds to cover the deficit. And so I think the direction that we've been talking about and the direction I've gotten from the finance committee at least is that in the ESSER funds, first and foremost, we need to cover the deficit in the elementary and the high school. So you're not going to see a request tonight to cover deficits out of the interlocal agreement fund, right? Because we're not going to do that. We're going to cover that with ESSER first, and then use the rest of the ESSER in a variety of ways. And so then the next year, because we have a deficit and we don't have any new money, so in that first column, you'll notice that there's no elementary levy. But in the second set of columns, you see the levy coming in next year. And so then if you follow that to the bottom, to the very bottom, we'll have $1 million deficit, but we'll have ESSER 3 funding. And again, kind of our plan is that ESSER funds would be used to cover deficit spending. And on the high school side, believe that this spring we need to run a high school levy. And we might do a similar thing to what we're doing now with the elementary levy, is that we have extra to fund it, so we wouldn't, we kind of need to use those mills if we can. I'm gonna retract that. So anyway, then we go into year 3, and again, we're at a 1.4 deficit and a $2 million deficit because they continue to grow because there's no new money. I did estimate a 1% A and B increase each of these years. And you can also see kind of about a fourth of the way down, you see some green numbers, 1.5%, 2.57, 1.8. Those are the projections of new money from the legislature. So new money from the legislature is in here. We have been negotiating collective bargaining agreements. Those estimates of those increases are in here, that sort of thing. So this is a pretty, I mean, this is a 30,000-foot view, but it's better than not looking down the road at all, okay? So then, but I did estimate some enrollment increases, and we have a 30-year history of a 1% increase. I mean, that's kind of hard to argue with. I mean, we might get a bump, but we've seen, historically a 1%. And the other thing that happens then in year 3, even if our students return over the next 3 years, right now, the 3-year average, that 3-year rolling average A and B is what's holding us up. But 2 years from now, that last high year is going to drop off. And now our 3-year average is going to be those 3 low years. So even though we think in our minds, oh, more students is going to increase our A and B, we've got an issue because right now we're using 3-year average. And we would have to have a huge bump to get out of the 3-year average issue and what's going to happen to us in year 3. But anyway, then in year 4, no more ESSER money, but we will have money in the interlocal agreement fund, right? But we're at a 1.7 and a 2.8 million deficit, and those are huge. That's too big. We've got to start to turn the ship a little bit between now and then, right? But anyway, this gives us a 4-year look to just kind of help you think about the adoption of the budget tonight. So Kelly, would you go back out and bring up the elementary general fund levy? So you don't actually have to take action on this. I did not include that levy in the budgets that I'm presenting for approval tonight, but I kind of feel like it's probably something that you do want to make a conscious decision. I don't want to just, kind of de facto not levy that. And you also don't ever make a negative motion. So what you see there is the 557 that was approved, 7.75 mils. I'm suggesting a motion to postpone the imposition of that levy for 1 year. And if you choose not to take action, that's fine. It's an elementary only vote. And you can say, Gwen, we don't need to do that, or you can take action and make a statement in this regard. So, questions about that? Ursula?
If we don't impose a motion, if the levy begins this year, plus we do what you were talking about with the other mills, would there be a change? It will go up. People will see a change.
Any other questions? Any other questions on the board? Okay, so this is an action item, so we will allow public comment. Is there anybody here from the public who wants to make a comment on this item? Okay. Would anybody like to make a motion?
Motion to postpone the imposition of the elementary general fund levy in the amount of $557,158.7.5 mils for 1 year.
Thank you, Kim. Is there a second?
Seconded. This is Rebecca Linden.
Okay. Scott beat you out, Rebecca. Okay, it's been moved and seconded. All in favor, please say aye.
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 Any opposed? Okay, motion passed unanimously.
Okay, Kelly, if you'd open up that final budget adoption, and so the front page is the recommendation, and there are two motions on here, so if you scroll to the bottom, the first motion is to adopt the budget as you saw them presented. And then the second option, and we need two motions, the elementary and the high school, to adopt the budget as presented with the addition of those transportation mills that we, those, recapturing those mills and putting them in transportation. And then thirdly, if you would, make a motion to move forward with the transportation, then we can give the architects and engineers to go ahead and we don't have to bring that back around. So option one is you don't want to capture those additional mills, you just want to, approve the budget as they're presented. Option two is if you want to recapture those, I'll have to go back and make adjustments, but all the numbers are in the information. Questions there? Is that clear?
So is there a board member willing to make a motion? Elementary?
I'd be glad to. I'd move to approve the Kalispell Elementary budget, the respective mills for each fund and cash reserves for 2021-2022 fiscal year, as well as the additional transportation mills as presented.
Thank you, Lance. Is there a second? Thank you, Ursula. It's been moved and seconded. All elementary trustees in favor, please say aye.
Aye.
Any opposed? Say nay. Rebecca?
Oops, sorry, aye.
Thank you. Okay, it has been, the motion has been approved unanimously. High school motion, this is district-wide.
I should clarify that it sounds like we're addressing option B and not option one. I want to make sure everybody is clear on that.
Third,
Option B is one.
Right, and the motion itself speaks to replace anything else, so.
Make the motion that we motion to approve the Flathead High School budget, the respective mills for each fund, the cash reserves for fiscal year 21-22, as well as the additional transportation mills as presented.
thank you, Jack. Is there a second?
Second.
Thank you, Diane. It's been moved and seconded that we approve the high school budget as presented. All in favor, please say aye.
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 Any opposed, say nay. Rebecca?
Oops, aye.
Thank you. Motion has been approved unanimously. District-wide motion, is there a trustee?
I move to approve to move forward with the transportation and maintenance facility based on the identified funding sources.
Thank you, Jack. Is there a second?
I'll second.
Thank you, Kim. It's been moved and seconded that we move forward with the transportation project. All in favor, please say aye.
Aye.
Any opposed, say nay. Rebecca?
Aye.
Thank you. Motion has been approved unanimously.
And thank you
Yeah.
for that. I know you spend a lot of time on this and hear, over and over and over, but it really helps me if I feel like you fully understand and I'm just not out there, going rogue and doing whatever it is I want to do, right? So, it does, it gives me, it makes me more comfortable with the direction we're going.
Well, it's very encouraging when you get it down to the dollar.
Jack?
Did we finish the discussion on the 4 years of the budget forecast?
If we have questions or,
I'd like to make sure the board knows that we may be having stimulus money for this fiscal year that we're in right now, that we're approving the budget for, as well as the next 2 years, but we don't have that funding for the fourth year. And our interlocal agreement, even though it may have $6.1 million in it, we have 3.5 reserved for curriculum, turf, 3 tracks and 12 gym floors. And that's what we need the money for. And it doesn't look like there's gonna be any money going into the interlocal agreement. And so what's net left in there for that 4th year is $263,000 in the elementary to cover a $1.7 million deficit, and 2.4 to cover a $2.9 million deficit. So we, even though we've got this stimulus money, we're encountering a lot of deficit spending. The recurring expenditures are greater than our recurring income, and we've got to figure out now how to start addressing budget cuts. Yes.
Do you know, either of you, what percentage of maximum we would need to be at to cover that deficit? Is it at 99%, does it cover it, or is there still a deficit?
Well, on the elementary side, we're, depending on our growth in students, we're at 98%. So we don't really have much growth. We, a couple $100,000, and we're looking at a 1 point. I mean, there's no place to go. We can try building reserve. We already have a technology levy. We could maybe try to do something bigger there, but we're, on the elementary side, we have to have a serious look at how we're gonna do this. And on the high school side, the $2 million levy would get us to almost to max. And, because we're quite low on the high school side. So we still, have some shortfall. So we need to attempt to pass a levy every year between now and then, and hopefully get that done.
The like you said, $2 million would get us there. Does $2 million still keep us under maximum?
Yeah, $2 million would keep us under maximum, and our shortfall, roughly 2.8. So we would have some changes that needed to happen, even if we got a levy passed. The elementary side is a little more concerning because we really don't have any place to grow. And, yeah.
Jack?
And these forecasts include a 1% student population growth each year. So there's been, if you look at the last 30 years, it's ranged anywhere from just 0.5% per year to 1.25% per year. But the average has been 1%, and that's the best planning tool. So even though we may have cash reserves, that's going to only help us for 1 year. And then we have to have budget cuts the following year. And with the lack of success of passing high school levies, we have to assume, even though we'll put small proposals in front of the public, maybe $500,000 this year, $500,000 next year, in order to have some kind of incremental growth coupled with the reduction in mill levies because of the increase in taxable values, it still won't be enough. There's still budget cuts that we have to start facing. So it's an interesting nuance that even with all the stimulus money, we still have to look at cuts. And that's not only us, that's statewide. Great Falls is doing, all the schools have to figure out budget cuts, so we're not alone in that. Stimulus money was designed to cover certain expenditures. It allowed us to put $1.8 million into the interlocal agreement this year, but that's part of the numbers I just quoted of 263 and 2.4. And so it may sound lucrative, but it's not.
And I do think it is wise for us to keep this in mind as we're moving forward. I don't like surprises, so let's keep this in mind as we move into the next few years. Any other questions while we're on this? Otherwise, let's move forward to the next item, banking arrangements. This is still you, Gwen.
Yeah, it's a simple one. I need to have Aileen Sperry, who's the new student activity person in the district office. She needs access to Glacier Bank, and they need action from you in order to give it to her. So fairly simple request there.
I'd make that motion as presented.
Okay. Thank you, Lance. Thank you, Ursula. It's been moved and seconded. All those in favor, please say aye.
Aye.
Any opposed? Rebecca?
Aye.
Thank you. Motion passed unanimously. Next item, Indian Education for All grant application. We get to hear from Matt.
Yeah, thank you. I appreciate your consideration for this grant application, and I hope that OPI makes the same consideration and ultimately this approval. This grant application is for $12,000. OPI made those funds available earlier this summer. We collectively put together a plan that mainly focuses on professional development and then incorporating multiple layers of professional development into a curriculum review that would end with a phase 4 revamping and new considerations for how we use that money across the district.
Any questions from board members? Yeah?
So, Matt, given the lawsuit that was, brought to everybody's attention a couple of weeks ago, is this designed around trying to address some of the components in the lawsuit?
So the lawsuit would be good timing for us because our grant application looks good in lieu of, or in light of, I guess, the lawsuit, but it wasn't our intent when we applied. We applied for the grant prior to the lawsuit becoming public, but our application does address the concerns that are noted in the lawsuit.
Thank you.
Any other questions? Somebody like to make a motion?
Remember to put my mic on this. Motion to approve the Indian Education for All grant application.
Is there a second?
A second.
Diane, thank you. It's been moved and seconded that we approve the Indian Ed for All grant application. All those in favor, please say aye.
Aye.
Any opposed, say nay. Rebecca?
Aye.
Thank you. Motion passed unanimously.
Thank
Thank you, Matt. Okay, Human Resources Personnel items. Tracy?
So
There you are.
the first action is to
Anybody want to make a motion?
Move we approve the personnel action.
Thank you, Will. Is there a second? Thanks, Scott. Been moved and seconded. All in favor of the motion to proceed with the new hires? All in favor, say aye.
Aye.
Any opposed? Rebecca?
Aye.
Motion passed unanimously. Bus monitor.
Great, I'm gonna use Gwen's mic, so I don't have to hold that. We have talked about this in both the Personnel and the Finance Committee, but I am bringing forward tonight, the proposal to enter into a memorandum of agreement with the classified union to change the bus monitors from Category 2 to Category 4. The reason for this is because we were having, even last year, we're having some significant problems recruiting our bus monitors. So last year, Annie just gave me these numbers, but at the end of last year, she had 4.5 monitors and 3.5 openings. So at the end of the year, we were able to fill one of those positions, but it was in the springtime. Bus monitors. And then this year, we have 2.5 filled and 5.5 open. These positions are really critical. These people that ride the buses with the students, they help manage those students, so it's kind of like a classroom on wheels. The bus driver's only responsibility is to drive, which is what we want. And the bus monitor helps us manage these. Some of these kids might have some emotional issues, different supports. A lot of these positions are written into IEPs, and so these are not nice to have positions, but they are needed. The other unique thing about this is that they are 2 hours in the morning when the buses are running, and then they're 2 hours in the afternoon. So it's a very unusual shift.
Sometimes we have been able to be successful to have a bus monitor in the morning and then have them transition in the classroom, for the remainder of their shift. But that's not always been successful either. So we are trying to do everything we can to, make this more of an appealing position. So this position would go from $12.87. The range is currently $12.87 to $13.98. And we would like to increase it from $13.98 to $14.80. Financial implications will be about $12,000. Any questions?
What, is this transportation funding?
Yes.
Thank you.
Any other questions?
This is Rebecca Linden. We'd asked about, could it be moved to SPED funding, to federal SPED funding, as this was mostly about IEPs, and I don't know if we explored that option or not.
Rebecca, our special ed funding is spoken for, and there's really no benefit to moving this to a federal program when we can use a permissive levy in transportation. And it's actually a transportation.
Thank you.
I did look at that, but I think we're on the right track with our recommendation here.
So if you approve this tonight, what will happen is I will engage with the classified union and we will work together on an MOU. I've already kind of prepped them a little bit and they're supportive of this as well. And then when we enter into a memorandum of agreement, we will bring that.
Thank you, Tracy.
Sue, can I make a motion to approve as presented?
Absolutely. Thank you, Lance. Is there a second? Thank you, Kim. It has been moved and seconded that we move forward with this as presented. All in favor, please say aye.
Aye.
Any opposed? Rebecca?
Aye.
Thank you. Motion has been approved unanimously.
Thank you.
Okay. Next on the agenda is construction contract change.
KMS staffing.
Oh, KMS staffing, excuse me. Micah?
We have a elementary administrator who was diagnosed with cancer earlier this July. We have explored a lot of different options as to how to best support that person, but also support the middle school. They have 1,100 students, over 100 staff, and they need the administrative support. And not knowing how that cancer treatment is going to unfold has left some questions, in terms of how we do that. And the staff member has expressed an interest to work when able, but it could be a year of pretty intense cancer treatment. And we are asking for a interim 1-year only position of administrative support at KMS to help with that. And part of the reason why this comes in this form is that administrators don't have substitutes. There's no one that we can call on a day-to-day basis like you maybe would be able to do for a teacher. And having those administrative credentials, if they're in an evaluative role of teachers or coaches or whatever, and dealing with student discipline, those kind of things, it's an important part of what we do. So,
Micah, do you see this interim position being filled from within?
In conversations with Trig, that would be the ideal. But then then you get into this backfill, but we would just open it up and see what's out there and available.
So the current administrator will work as much as they can.
Yep.
And then this person will only work within the weekends, or they will just both work?
They'll both work.
That's last worst case scenario.
Yep.
We have an extra, okay?
Yep.
And you, Diane. Is there a second?
No, it's elementary.
I'll
This
second
is
it.
elementary only,
yeah.
sorry.
I'll second.
Ursula. It's been moved and seconded that we approve the one-year-only interim middle school assistant principal. All in favor, please say aye.
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 Any opposed? Rebecca?
My heart goes out to the assistant principal, and of course I say aye.
Thank you. Motion carries unanimously. I am looking at our audience right now, thinking we have a lot of people here for public comment. So I would like to make a change in the agenda to move public comment next on the agenda in front of the policy update. I do need a motion and a second and a vote.
Sue, do we wait for public comment or the safe return to schools? I mean, if it's on the agenda.
For the safe return to schools, sorry,
Are you asking to change the agenda around?
yes. With the, the safe return to schools and continuity of services plan would be moved up in front of the policy update.
Okay, we'll talk.
It's a change in the agenda, so I do need a motion.
I guess I would move that we next address the safe return.
I'll second.
Ursula, Heather, thank you for the second. It's been moved and seconded that we move the agenda items around to address the safe return to schools and continuity of services plan next. All in favor, please say aye.
Aye.
Any opposed?
Nay.
Rebecca?
Aye.
Okay, 9-2, motion passes. So safe return to schools and continuity of services plan. Micah?
Okay. When I started this job, I didn't have any gray in my beard, so
I know
You didn't have a beard.
I couldn't even grow one then. Thanks, Lance.
He's having like an Obama person.
The safe return to schools and continuity of services plan is an item that is standing on our agenda till 2024. And currently, we are open in phase 3. We approved that in a June board meeting. And things have changed since June. I think we're all widely aware of the increased case counts in Flathead County, the Delta variant, and some changing guidance from the CDC and the American Academy of Pediatrics. We have spent literally the last 2 weeks, and probably every school in Montana that is currently operating in phase 3, scrambling to figure out what are we going to do and what is the best option, and maybe best option isn't the right phrasing. And having wrestled with this and talked it over with a variety of stakeholders, receiving input via email, phone call, meeting with our COVID Advisory Council, and county health departments, and other area administrators, we're in a tough spot. And I'm in a tough spot to make a recommendation to the board. I vacillated between making lots of suggestions without a recommendation. We have talked about how those different options would present and what complications they have for a school district in light of some legislation that currently exists. And I'm referring specifically to House Bill 702 as one of those. And then recognizing what is our priority and what did the board identify as a priority last year. And that priority was to return to in-person instruction. Half the country did not return to in-person instruction last year. And we did. We had there were definitely hard times, but we made it work. And as we move forward into this year, with a lot of hope and optimism about things to come and how we're going to be better and how we're going to improve on what we do best, which is providing education for our kids in a safe and healthy environment. I don't think any of us are oblivious to the challenges that existed last year. Everything from protests to having to cancel school board meetings to difficult elections, all of those things. They all become a part of that. I think when I met with the COVID Advisory Council, which included Dr. Craig Lembrecht, who's the CEO of Logan Health, it included Joe Russell, the county health officer, it included nurses, it included 2 other pediatricians. One of the things that I really struggled with and that I really struggled to wrap my head around is how can school districts be the only, and only is a pretty strong word, but the only organization that is going to require anybody to mask in a community and in a state that doesn't support that. It sets our board up for a great divide. It sets our administrators, our students, our faculty. And we saw that last year. Ultimately, I am presenting to you a recommendation that we remain in phase 3 of our pandemic operational guidelines and adopt our recommendation for a change to policy 1905. Policy 1905 addresses a lot of things, but I think the one that is probably of why a lot of people are here is masks. And there is scientific evidence that masks work when correctly worn, when changed frequently, when not touched by your hands, when you do all the right things, that they are an effective source control mitigation strategy. We also know that the mask does not prevent a virus from getting through, but it does help with the source control, which contains the virus that gets through. And so I don't really want to get into the debate on whether masks are effective or not. I believe they are. I think we have many board members who believe that they are, but we also have a community that says we think it is an individual choice, that it should be personal responsibility. You're going to have a hard time convincing me that a 8-year-old is making a choice based on personal responsibility. Those are parent choices. Those are parent influences, and we don't control that. What we do is we say either we're going to require them or we're going to let people make that decision. And in that recommendation, the people who we have advised us over the past year and a half, we really value them. They give us good, solid information. They were also in agreement with us that this would be really hard for a school district to mandate when kids would be in school for 7 hours a day, but then they're going to go home to a family that isn't going to mask. They're going to go to the fair. They're going to go to their churches. They're going to go to all these other places where they could potentially get the virus that has absolutely nothing to do with school or whether or not we are wearing masks in school. The other part of this is that we have a host of mitigation strategies. The medical professionals, the county health officer, Joe Russell will tell you that the number one is vaccination. We should be encouraging people to get vaccinated. We can't require it. We can't ask them if they are. Well, we can, but they don't have to tell us. But that should be the number one thing. Masks are certainly a part of this. Hand hygiene, cleaning and disinfecting our high touch point areas, increasing our air filtration and airflow in our schools, having the ability to do rapid testing for anybody who wants to, Temperature checks, illness screening, both at home and in the school, are also mitigation strategies. Encouraging people to stay home when they're sick. We did not allow the high school to have an attendance incentive for this very reason. There are other strategies that are in place that will continue to be in place in phase 3. Our elementary students are in cohorts. The kindergarten stays with the kindergarten, the first grade stays with the first grade, and that's a group that we're talking about. There is a group of individuals who don't have the opportunity to be vaccinated yet. And I've heard a lot of feedback from our community expressing that very thing, right? My child is only 8 years old, does not have the opportunity to be vaccinated. Please require masks so that my child is safe at school, or so that my family is safe at home. And that's a big part of it. We are still going to have social distancing. We are still going to have isolations and quarantines. Anybody who is not vaccinated in our schools that is a close contact will be required to quarantine. That is CDC, county health, federal health. That is what has to happen. It's not an argument. We also have deputized contact tracers last year. I have a new agreement where the county health department is asking us to be that for them again, because we are an immediate source for tracking and tracing COVID in our schools and to prevent spread and infection. So there's a whole host of mitigation strategies that are also a component of this. I don't think masks in isolation are the thing that does it all. It is all those other things as well. Specifically in the, can you scroll up a little bit more, Callie? Other way. Yeah, right there. So policy 1905 in a large part remains exactly as it was written. Montana School Boards Association, a group of attorneys who advises school boards on recommended policies or required policies, sent this out, and they listed, here's option 1, here's option 2, here's option 1, here's option 2, and school boards are left to make that decision. Physical distancing to the greatest extent possible, those kind of things, but in particular, face coverings as personal protective equipment. And the opening paragraph says, staff, students, and visitors may wear a face covering, mask, or face shield while present in any school building. The school district strongly recommends that individuals refer to state and federal guidelines related to face coverings, consult with their healthcare provider, and make the decision based on personal circumstances and preference. Not everybody has an underlying health condition. Not everybody has, a belief that masks work. Not everybody has, there's people that don't believe COVID exists, but this is where we're at. We also have a piece in here that talks about allegations of harassment. One of the concerns that I've heard from parents and from teachers and other people is, well, if I wear a mask, am I going to be shunned? Am I going to be picked on? Am I going to be harassed for doing what I think is best for me? And we are not going to tolerate that. The last piece of this is, if after this selection is adopted, the number of active COVID cases in the county where the school district is located increases to the point of threatening school closures, the Board of Trustees authorizes the superintendent to implement a requirement for face coverings. This has been a point of concern for our community, and I think we faced that last year when we were talking about, at what point would we close schools down? We resisted that. We said we want our schools open. We value in-person learning, but we also provided opportunities for remote education. And with this, one of the things in the CDC guidance is that in counties of high transmission, moderate to high transmission, with a certain percent positivity rate, with a certain number of cases per 100,000, that is where their recommendation came from. The COVID Advisory Council, we talked specifically about metrics, and they said, we actually wouldn't encourage you to use a metric for that purpose, because your metric is only as good as the input. When you look at, and I get the weekly report of every test that was conducted in the state, and then the number of positive cases, and they've broken it out week by week, county by county. What you see is a decline in the number of people actually getting tested and an increase in the number of cases. So one of the things that happens in that inherently is that sick people who have symptoms, go get tested. So unless we were doing universal testing on every resident in Flathead County, we wouldn't know what the true transmission rate is, and we wouldn't know what the true positivity rate is. All you have is the information based off of those who select to go get tested and whether or not they come back positive. That's not to say that those aren't real numbers, and when you see a positivity rate of 15% or 20% or 6%, it's only as good as the information that you're putting in. The other thing that we resisted last year when we talked about metrics was trying to do something from a countywide perspective. We are Kalispell. There's also Whitefish, Columbia Falls, Big Fork, Evergreen. You have all these other little communities within our county, and I don't know whose child belongs to which county. So we kept our own data on the number of infections, the people who were put into isolation, and the number of people who were in quarantine. And when the conversation came up, should we close schools down, it was based on a couple of different things. One is, do we have the staff and capacity to keep our schools open? And that was different for every school, and it could be different for a grade level. So we did not want to put anything in place that would, one, require a shutdown when we really didn't need to do that. So if we use the middle school as an example, last year they had a high rate of quarantines in the 7th grade. We didn't need to close down 6th and 8th grade, but 7th grade, it was certainly challenging and difficult. So there is this caveat in here that if we're put into a position where it feels like schools are being threatened to close, which we know has a huge economic impact on our families and our businesses and our community as a whole, then we need to be able to react. And in this, it says in coordination with the board chair and the county health officer. So it's not just me sitting in my ivory tower making decisions. There's a lot of conversation that would go into whether or not that would be required. But that is what we were trying to safeguard in all of this. The rest of the policy remains relatively unchanged. Still doing cleaning, disinfecting, all those other mitigation strategies. And I have some data. I don't know if the board wants to hear some of that data.
I would love to hear data.
You love to hear data.
All of it, yeah.
On a bright note, I went through all of the 1900 policy series and looked for some things that maybe there were discrepancies in. MTSBA hasn't necessarily sent updates, but there are things like that refer to fiscal year 1920, some different things. But as a whole, I think our policies are in pretty good shape with the exception of 1910 and 1905, which we're asking you to look at tonight. From a data perspective, I'll find the right documents here. Since July 27th, I have received, and this was up until about 6:30 tonight, 26 emails from people who were asking that the board require masks. And then I received 8 emails from people who I would refer to as pro-choice on masks, leaving it up to the individual. I think last year there were times when we referred to them as anti-maskers, but that has not been the tenor or tone of most of the emails that I've received. It is, please let us make the choice. Pull up an email here real quick. I asked the county health department to run the numbers on how many of the current active cases in Flathead County are school-age children. There are 52 between the ages of 5 and 17, which, again, I don't know if those are kids in Kalispell or Columbia Falls or Big Fork or Whitefish or where they're at. I don't know that they belong necessarily to our district, but you figure 15,000 students in Flathead County and there are 52 positive cases right now. Joe Russell, who has informed us on what is going on from a contact tracing standpoint, said that their information shows that these are cases that are occurring in the family cluster, meaning it is not just one child, but maybe 3 children who have contracted it from a parent who is unvaccinated. So these are not casual transmissions. Granted, when we open our doors for school, we are putting 20 to 30 kids in the classroom. So casual transmission is a possibility. The COVID variant is 6 to 8 times more transmissible. But some of the data that was shared with us, Craig Lembrecht said that the mortality rate on COVID-19 for all of 2020 was 0.9%, so less than 1% of all people who contracted COVID in 2020 died as a result. 98% of them had a comorbidity factor, so that exists. For all of 2021, that percentage has dropped to 0.5%, and that is not because COVID is any less lethal. It is just because they've also developed different treatments and ways to help people survive that might have some of those other underlying conditions. The overall hospitalization rate at Logan Health for all patients with COVID under the age of 17 is 1.3%. According to the county health department, we have had a total of 1,739 children with COVID since March of 2020, and 23 of those have been admitted to Logan Health. We have not had any pediatric deaths from COVID directly, and that is coming from Courtney Patterson, who is a MD and in charge of child wellness for Logan Health. So, is it out there? Yeah. Does it exist? Yes. Are children being hospitalized? Yes. But they're also being treated. One of the other concerns brought up by one of the pediatricians was that they're seeing nationwide 50% of pediatric cases of COVID, they're having longer symptoms persisting beyond what would be the norm. So if they lost their sense of taste and smell, if the average was 2 weeks, they're seeing it prolonged and maybe even out to 6 weeks. There's some concern around the way COVID affects the cardiac area of your body, around your heart and inflammation, things like that. So I'm not trying to sugarcoat it. I know exactly what my recommendation means. And that's a hard one. Have really struggled internally on what the best recommendation is. And there are some other things that we have to consider when we adopt the policy. One of them is remote education, and I can let Callie and Matt speak a little bit to that. The board approved a 2-tiered approach. Tier 1 was, we're not doing remote education because hopefully we're past COVID. There's been a resurgence, and this decision may create the need for limited remote education. What I can tell you is that we are not in a position from a budget standpoint or a staffing standpoint to do what we did last year. It's just not going to be feasible. There are some personnel considerations that need to be discussed, and those will primarily happen at the administrative level, but there is potentially someone who has not been able to get a vaccine because their doctor has advised against it because of whatever their health condition is. And so when they come to us and say, is there an opportunity to work remotely, there may not be. Yeah, I'm going to stop there.
Thanks, Micah. And I want to echo what Micah said about internal strife. This has been kind of a difficult conversation. I think we've met, maybe 4 times, Micah and I and Jack, just to talk about our various options. And I think I flip-flop every time we meet. But in looking at the big picture, I'm very pleased with the recommendation that's coming out from administration. And I'm just kind of holding my breath that we can stay in school. I mean, that's the big thing. We know the kids need to be in school, and, you've heard me say student achievement is, my underlying goal for this year. And I'm just really proud of the recommendation and the courage it takes to bring this out. Just the other day, I was reading a book about Winston Churchill, who said at one point that courage is being able to stand up for what you believe in, but courage is also sitting down and listening. And I think that's what we have done, is listen to the entire community. We know we have very different opinions, but we are here, and I want us to stay together as a community. Are there any clarifying questions from the board? Jack?
So the motion up there talks about the operational phases, so can you point out in the operational phases the language change that you're proposing for face coverings?
The operational phases, which there is a document at the end of the, so those were adopted a year and a half ago as we struggled to open up. The changes that are in there reflect face coverings at the discretion of the individual based on personal circumstances and preference. Be the primary change to that document. The pandemic operational guidelines, which is the 30-page book on everything that we do, is also updated and reflects those changes based on the recommendation tonight for the language that's in policy 1905.
So my last question on clarifying that motion that's up there, where it talks the operational guidelines to adopt the administration recommendations. Do those recommendations include the little fine points of updating the fiscal years and some of the other nuances you found in there?
Those are in different policies, Jack. That'd be like 1901, 1902, 1903.
Should we address those also?
I would say they don't impact our operations. They're just details. And I think we can bring those forward at the August 24th meeting.
Thank you.
Ursula?
Kelly, could you pull up the page that has the part about masking and the
Subject. No, keep going. We're in the right document. Yeah, one more down.
Yep, it's there.
Yeah, so, the wording where it says, if after the section is adopted, if the county where the school district is located increases to the point of threatening school closure. And I guess the only point of clarification that I would be looking at is, we have talked about the importance of activities to students and their mental health and their overall involvement in school. And I'm just wondering if, basically, I feel like this is a very measured approach, but I do think that choosing activities would also be a reason to potentially change our rules on masking.
Yeah, I think it has that potential. When I think about threatening school closures, I'm thinking about if staff are unable to work because of quarantines of their own children, if staff are unable to work because they did not get vaccinated and have to be isolated, or we're a breakthrough case, or we're just quarantined. for any number of reasons. So that's what I think of when I think of threatening school closure, is the ability to keep our staff in place and keep instruction going in person.
So do you feel like this addresses that if we were having enough spread amongst schools, that it was impacting activities, that would also?
Yeah, and I think we saw a little bit of that last year. You know, the example would be the volleyball team that had a little hot tub party after a game or, you know, a practice, and then one of them was sick and everybody got quarantined, and then that volleyball team couldn't play. So in my mind, that doesn't threaten a school closure. It certainly threatens an activity, and especially knowing that isolations and quarantines will continue just like they did last year.
And last activity question, is the idea that activities, I mean, everything is proceeding as stated in phase 3?
Yeah. Yeah, we have not seen any additional guidance coming from the Montana High School Association, which last year imposed some of their own requirements and required shortened seasons, limited travel, no overnight trips, different things like that. So we have not seen anything like that. And in phase 3, it does say extracurricular activities resume per MHSA guidelines, and right now they're fully open.
County though, that's they may or may not allow.
The home team makes the determination for the traveling team in terms of that requirement. And I should point out one point of clarification with regards to that recommendation. Face coverings are required on school buses. That is federal law. Just like if you were going on the airplane or anywhere else. And so that will remain in effect. If students want to ride on district transportation, they will have to wear a mask.
Lance?
Mike, I had a list of 10 questions, and you nailed 9 out of 10, so kudos to you. The one question, though, I just kind of want to get a feel of how staff are feeling about masks and the choice.
Yeah. There are certainly staff that have a strong opinion about it. I know that the KEA surveyed their membership and the classified surveyed their membership. I won't say the returns were great. Over 200 staff, 9.5% of them wanted to see masks required. About 50% said, you know, leave it up to choice, and the other, whatever remaining percentage that was, basically said, we'll do whatever.
Will?
Oh, Micah, I was looking at the, one of the policies about health screening. I think that during a pandemic like this, not wearing masks, health screening becomes more important. According to that policy, we're leaving all health screening. But I'm wondering if maybe we should have health screening at school before throwing a child into a classroom.
Yeah, so when it comes to health screening, we do want that to be primarily a parent's responsibility. So in those operational guidelines and pandemic phases, you know, check your child's health before you send them to school. Ask them if they have any of those symptoms. If a child comes to school and is symptomatic for anything, and it doesn't matter if it's COVID or the flu or whatever it is, we have nurses and office managers and administrators who are checking temperatures, who are doing those kind of things. One of the things we were trying to avoid last year in that recommendation was, you know, the idea that you could take every kid's temperature, and if they've been running around on the playground before they came into the building, they could have an inflated temperature because their core body temperature was up. And so those health screenings, we still do and have always done and will continue to do. It's just not going to be every child at the door as they walk in.
My concern is, I mean, we're talking about following the CDC guidance, and we're talking about PCR testing and screening, and the CDC is the one who came out saying that they are no longer going to be using the PCR testing as of December 31st because they can't determine flu or COVID. But we're going to be using this testing to quarantine people throughout the fall, even though the CDC has said this is a faulty test.
Yeah, I don't know if I can answer that for you, Heather. I know that the testing that is available to schools and through the governor, who appropriated about $37 million for that purpose in public and private schools, is a rapid test. And I don't know if I know all of the science behind that. We did use it at our Care Here clinic for staff and dependents last year. And even with a positive on a rapid test, they're still asking you to go get tested with the PCR testing.
Any other questions from board members?
This is Rebecca Linden. I do actually.
Go ahead,
So-
Rebecca.
So on the section up on the screen, it has it under face coverings that if the section adopted in the county where the school district is located increases the point of threatening school closures. And actually, the more I look at it, the more I wonder if this should be under face coverings or if this should be a separate section. You know, if the cases of the county, the school district are threatening school closures, then, you know, action needs to be taken. That might be closing a building or a classroom or moving to phase 3 or you know, or going fully remote. I mean, it seems like this is really its own section and not particularly about face coverings, but about what our responses will be if the the number of COVID cases increase to the point of threatening school closures.
So I'm not sure there was a question in there, but what my response would be is that this belongs under that heading because what I'm asking the board to do is to authorize me, when I consult with the county health department and the board chair and the building administration, to require face coverings if we are looking at potential school closures. Not saying that I'm going to close schools. That's not what this is. What I'm using is the metric of, can we continue to be staffed and remain open without face coverings? I don't know if we can. And so I want to be able to have that ability to say, hey, county health department called me, there's an outbreak at Flathead High School or whatever school. You guys need to start wearing face coverings because we are not going to be able to contain this. And you will end up having to close your school down.
But would this just be about face coverings, or would this be a full move to all the suite of differences that happen in phase 3 rather than phase 2?
This would be addressing face coverings.
I guess what I'm proposing is I would like to see a section dedicated to what occurs if the number of active COVID cases increases to the point of threatening school closures. I think that as well as face coverings, that is a whole area. And, you know, yeah, the possibilities of moving to phase 3. I mean, I think we have a number of responses that we may need, which might include face coverings, but might include other options as well.
Ursula?
Yeah, but so Micah, those things are covered in the rest of the 1900 series, right? Like, and in the other phases, those kinds of policies are still in all of those other places still, is that correct?
Yes.
Okay. Does that clear it up at all, Rebecca, that those things are there, they're just, this was added also into here?
Not really. Yeah, I think that is more about moving to phase 3 than about face covering, which is a part of a suite of changes. It's not specifically just one part of it. And so separating it out into a section about what happens if the school, if the number of COVID cases increases to that point, would help my clarity and understanding. Because
Rebecca, what I would like to do right now is we're still in, the clarifying portion of this discussion. I would like to open it up for public comment and we can deliberate more. I am very comfortable with the way the policy is because those procedures are in the policy, whether or not they're in the section on face coverings or some other portion, they are still there. So what I would like to do is move on. We can circle back to your concern during our deliberations. Okay?
Sure, thank you.
Any other questions from board members before we move on?
I'm going to make one more comment.
Yes, you can make one more comment.
And I know, Sue, you're going to open it up to public comment here in just a minute. And, as I look out on the audience and I reflect on, the people that have supported this school district and supported this board and the decisions that have been made, it's not lost on me what I'm recommending. Last year, we said, hey, this is what the CDC says, this is what the county health department says, this is what the American Academy of Pediatrics says, this is what our local healthcare providers have said. And it's not lost on me that it looks like now I'm saying what they said doesn't matter. It feels like there's a little bit of egg on my face. And I don't want this to be divisive. I don't want this to be something that casts a negative shadow over our district. And so, clearly the decision is the board's to make. You asked me for a recommendation. Well, maybe you didn't, but I gave you one. And it is not meant to put you into a position of discomfort or, just, I care about our community. I care about our kids. And I hope that this isn't perceived as not caring, that I didn't come to you with a recommendation to require masks for everybody. That's it.
Thank you, Micah. I am going to open this up to public comment. Before we do that, I want to just mention some norms of behavior for public comment. These are comments. They are not questions to the board. You will, first of all, could you please raise your hand if you are making a comment on this topic? Okay. Yeah. I'm going to limit everybody's comments to 2 minutes based on the number of people who want to make a comment. The board will not engage in dialogue with you at this time. We just want to hear what you have to say. I expect civil comments. If not, I will rule you out of order and ask you to sit down. And I ask you to address the board, not other members of the public, but the members of the board. Okay? We have a timer up on this board. And Jack will give the 30 second warning time so you know when to start wrapping it up. And you will need to sign in your name and your address. Is that all the information they need on there?
Just their name.
Just their name. Okay, great. Okay, so public comment. Who's first?
Hello,
Is this on? My name's Sean Pandina, and I live in Kalispell.
Did you write your name down?
I did at the door. I'll do it here.
Why doesn't the next person come up and as he finishes, they can sign their name?
So I like the recommendation to keep, masks as choice. But I don't like the fact that you're giving the superintendent the power to just at any point in time decide to implement masks without a board vote. I don't think that part of the policy makes any sense to me. I think that should require a board vote to whether you're gonna stay in 3 or go back to phase 2, my personal opinion. And then, I did hear Micah throw out some survey statistics. He said only 10% of the teachers want, or staff, I guess, want the, masks to be mandated, so 90% either don't care or want them to be optional. And then email-wise, that he's received 26 emails that want masks to be mandated and only 8 to be pro-choice. I think that's probably because you're already in phase 3. So I'd like to ask the audience, there's about 54 people in here, I counted them.
Sean,
If
you
there
need to
is-
address the board, not the audience, please.
This is for the board.
No,
Would you
you're
raise your
addressing the
hand if
audience.
you're here to
Sean,
mandate masks? Mandate masks.
Sean, you're out.
One person. One
Sean,
person wants to mandate
please
masks out of
sit down.
54. I'd
Please
like
sit
the
down.
record to show
you've been ruled out
that
of
there
order,
is
please sit down.
53 people in this room. Well, you wanted to throw numbers out for the, I still have
Who's
34
next?
seconds.
You're out of order.
There's 50 people in this room
Go.
that don't want masks to be mandated.
You're done.
They want them to be pro-choice. So this is how you always treat me, like dirt. And you want me to respect you? You're ridiculous.
Okay, next person.
Can you repeat the thing about?
Yeah, I'd like, the next person can come up as she's speaking and sign in. Thank you, John.
I'd like to try to say some of the facts you said. For the children to be deaf is less than 1%. Less than 1%. The flu is as dangerous or more dangerous to children than COVID. We all know that children, out of everybody, are at lower risk of transmitting, of getting it. I could not find a death in all of Montana, and I've looked for a child. Not one. And it's not uncommon for a child to die of influenza. In the Daily Interlocal, January 30th, I wish I would have brought it, they had a big article, no influenza in Montana, not one case. How could there not be one case of the flu last year? I appreciate your comment about they couldn't distinguish between flu and COVID. How could there not be one flu case? And going into this year, as we talk about the rates of everything going up, are there any flu cases this year? Are we going to have one more year of no flu? Can anybody explain that to me? How can we have no flu, but only have COVID? And I'd like to mention that as we talk about the cases going up, cases are not deaths. I know about 100 people that have had COVID. 2 were really quite sick. 1 did go to the hospital. Out of 100, cases are not deaths. We are so exaggerating this. So exaggerating. I don't think it's not, I do think it's real. I think some people die. I think some people get very sick, but you mentioned 90% are comorbidity. If that's the case, that would drop the case in Cycle Valley from 100 and something deaths to 10. There's been more vehicle accidents this year than that. But we're still driving. I don't understand the panic. The panic does not reflect the reality, and the common sense is just paying attention.
Time is up. Thank you.
My name is Teresa Farr, and 6-year-olds are trying to learn to read with their faces covered,
Thank you.
and teachers with their
We need
records.
to listen to everybody else. Thank you. Okay?
My name's Devin Decker.
Did you already sign in?
I did.
Thank you.
So, I want to start off by saying, I think we should just push for remaining in phase 3. Keep math optional. Parents absolutely have the right to decide what, health things that their children need to go through. I feel the health board has no right to decide across the board, whose child should wear what, considering masks. Another thing I want to bring up is, the page 2 on the face coverings as PPE. I think we should strike lines 35 and 45, which gives the superintendent, I think, too much power, because we could vote to stay in phase 3 now, and tomorrow, he could say permanent masks. So I think that should be a school board issue. You should face questions to all the people. Another thing I want to say is, if you go ahead with this measure and you do not strike lines 35 and 45 from face coverings PPE, the school district should be responsible for all financial costs caused by illnesses due to face covering, at least, because you're forcing this upon them against their will. Thank you.
Thank you, Mr. Decker. Hello, John.
Good evening. For the record, I'm John Fuller, representative for House District 8, West Kalispell. And full disclosure, I spent 45 years teaching public high school, the last 14 here at Flathead High School. And at the end of September every year, I got sick, whether I needed it or not, because after having the summer off, the students arriving infected me, of course, because that's just what kids do. Micah, I want to commend you for your efforts and and all that you've done to try to prepare and deal with the community's needs in this issue. We had a conference earlier a week or so ago, and as a co-sponsor of House Bill 702, the idea behind that is that people need to be responsible for their own children and their own health. And consequently, I believe that what you have here is a measured approach. An optional mask is the only common sense approach, in my opinion. And I commend you for taking that view and having kids in school. As an educator, I do know for a fact that there is no way that students can understand me when I'm in front of the classroom if I'm wearing a mask. Because 93% of human communication is nonverbal. 93%. And I spent my career communicating with young people, and I tell you that the masks are a severe detriment and impediment to education. So I thank you for making it optional. If people believe that masks work, so be it. If they want their children to wear them, so be it. God bless you. And I'm kind of glad I'm retired in another profession. Thank you much.
Thank you, John. Okay. Next, and I would like to invite the next on-deck person to come and sign your name up on the list.
Good evening, I'll make this short.
Name?
What'd you say?
Name, please.
Oh, my name is Dave Motis.
Thank you.
Some of you know me, some of you don't. Most people in here do. I no longer work as a sub in the school district because of this mask program. I had a 9-month ordeal getting rid of a cough because of the mask. 9 months. I had to quit. I worked here 5 years. 5 years. I enjoyed kids and some of you, people out here. Now I'm considering pulling my own children out of the school district and out of public school in general. It's unconstitutional anyway. End it. Thank you.
Thank you. Next, an on-deck signer, please.
Hi, my name is Nicole Schubert. I have a son at Kalispell High School. I hope I can get this out. I'm so nervous. So, your clock's not going. I moved here from another state that you guys all hate. We were on lockdown and my son sat at his desk at home for 1 year. He's in high school. I will tell you, he got depressed, and this is a happy child. And many high school students with good families who were on them were just dropping out, didn't want to have anything more to do with it. So I want to commend you for keeping the schools open. By the way, I'm all for no mask, that is clear. But I think I want to commend you also for being respectful. And therefore, I think that giving choice to people makes sense, and maybe to consider starting out that way, like you were talking about, because that seems rational and not knee-jerk, like everything else in our country. Looking at the town, how the town supports freedom of choice with masks, and I think that would be great to continue to reflect that in your schools. And you can always change. I mean, it's a small school district. You can put the masks back on, but it would be great to start that way since it seems to be working.
30 seconds.
The other thing is, talking about metrics, it would be interesting to know if the PCR tests actually measure for the Delta virus, because since most people are worried about the families at home who can be vaccinated, the adults, and that way you can measure only the Delta virus if it's been isolated in those PCR tests. That might be a logical solution then for making your decisions with the metrics, because the people who are vaccinated at home would be protected from the other variants.
Thank you.
I actually have a statement from Carrie Lynn, if that's okay, can I read it? Dear school board members, my name is Carrie, and I have kids that are and have been affected by mask mandates in school and in society. You see, for our family, this is not political, and it is not just a civil rights issue at all. It is a serious medical issue. My daughters and I have a rare medical blood condition that prevents us from wearing masks for any length of time. Early on in the mask mandate, my youngest and I both have medical emergencies while wearing a mask. Both were treated by medical professionals, and we have documentation to show for it. Masks are 100% not an option for us. And because of inflexible school mask mandates and lack of even medical exemptions, my daughters were forced to attend online school. This proved to be a subpar education and a punishment to professional growth. They were completely isolated from friends and from interacting with anyone for hours per day. Screen time is no substitute for real interaction. There is no one who has been through an online education this past year who believes that it is fair and equal substitute for in-person education. If it were a fair and equal substitute, we would be closing down all brick and mortar institutions in favor of strictly online learning, because it would be far more cost-effective to our cities and states. Kids deserve to have an in-person education without mask mandates. I am begging you to take the psychological and emotional well-being, along with all the health and all of our children, into consideration and make masking a choice for each and every person in your school buildings this year. All science shows the virus does not infect school-aged children and more than the regular flu, and all teachers have an opportunity to be vaccinated. It's time to take care of all of the kids you profess to care about. Mask choice is the least you can do. You'd also like this in a minute?
Thank you.
Can I?
We put a summary in the minutes.
Right.
You can pass it, yeah. And next person, please step up and sign in.
Hi, I'm Diane Taylor Mankey. I live in Whitefish. I've been a teacher, I've been a school board member, and I appreciate how difficult some of the decisions you have to make are. I think that one of the things you need to consider when you look at what happened last year is that you're dealing with a whole new disease right now. You're dealing with the Delta variant, which is much more spreadable and much more general age affected. The other one was people my age, but this is not. The Delta goes for young kids, and whether they die or whether they just get very sick, that's something to consider. If you were a parent, I don't think you would like to watch your little child be sick and maybe even end up in the hospital. Somebody said that that this was not like the flu. I talked to a mom today whose little guy last year in second grade wore masks every day, and she said he did great with it. And she had a child in high school, and none of them were sick. Either one was sick even one single day. And when somebody said there was no flu last year, it was probably because a lot of people were wearing masks and limiting the spread of the flu. Our county is notorious, I guess. We have 1.6 times the cases of COVID in our county that Missoula and Gallatin have combined. We have 1.9 times as many cases as Yellowstone County. We are not a county paying attention to this, and it's not fair to little kids who aren't eligible to get vaccinated to expose them. For people like the lady who just said her kids can't wear a mask, then make the exception that they don't have to if they have a medical reason for it. But I have a great niece who's going to be in third grade next year who has asthma, and her parents will watch where she goes after school. The parents who want to have their children totally running wherever they want to go after school is fine.
Time's up.
Thank you.
Thank you. Okay, next.
Hi, my name is Ingrid Kalispell. I'm a retired anesthesiologist and worked 26 years here in town. I know a little bit about masks since I basically lived in them for 30 years. So I would just recommend that if you're talking about masks, if you're going to use N95 masks with close fit, you might have some protection against COVID, but paper masks, I would beg to differ as far as effectiveness. They're good for bacterial and droplet spread in the operating room, but they're not a great barrier for viruses. And that includes the influenza virus, which is a much bigger killer of children. And as the other lady had mentioned, we nationwide in 2018-19, we saw 490 deaths of 5 through 17-year-olds. And this past year, through August, we saw 90. And there were no influenza diagnoses in Montana last year. Obviously, the test is questionable as far as crossover. So I'm concerned about going forward because if we go through this year and we do masks with cases but not hospitalizations or whichever one would be your trigger, data is hard. And this past year has been such a difficult thing for anybody who's used to looking at health statistics to try to get a handle on. So I say, even if you handle this year, then what's next year? Are we going to mask up every fall because we had some deaths which we couldn't tell if it was influenza or COVID? It'll be with us for the rest of our lives, COVID. We're just going to have to deal with it, and I think personal responsibility will be a major factor in allowing people to represent what they want to do with it. So those were my major concerns because you're going to have this as a recurring thing to deal with. I wish you luck. And I'm glad I'm retired, just like Mr. Coleman.
Thank you.
Hi, my name is Carmen Casperson. I didn't actually show up tonight with the intention to comment, but something Mr. Hill said got me thinking. The mother of an 8-year-old concerned about her child catching the virus from somebody not wearing a mask. So I'm wondering, does the mask work on the exhale or on the inhale? If you believe it works and you wear it, are you then not protected? Why do you need other people to wear it if the mask actually works? Wouldn't you be safe as long as you yourself just wear the mask? That was just a thought that occurred to me, and I think maybe we should all think of that. Thank you.
Thank you. Is there anyone else wants to make a comment? And anyone else that wants to make a comment, please come up and put your name on the sign-up sheet. Thank you.
Hi, my name is Margaret Dorr, and I live here in Kalispell. And I'm the one who gave you the excerpt from the COVID blog, which is not a mainstream blog, and they document deaths from people that got the vaccine. Because sometimes the vaccine is a killer. And the one that I gave you is a 22-year-old French man dead 9 hours after getting the injection. It's an experimental vaccine. There's a lot of disinformation. And so to be selling vaccines and encouraging people to take them, especially for young children, when it hasn't even been approved by the FDA or whatever is supposed to approve it. These are experimental drugs. Little kids don't get this stuff anyway. As a child, I was hospitalized in an oxygen tent. It wasn't that big a deal. I'm still here. And you should just let people go to school, beat each other up, and whatever the kids do is what they do. Thank you.
Thank you. And next sign up, if there's anybody left?
No. Hi, I'm Tina Tobiasen. Okay. I'm just going to read from the paper, so much easier for me. Okay. I never liked the idea of my kids in masks. I allowed it at first because, quite frankly, I was naive, and my kids wanted to be in school. They loved school most of the time. But as their attitudes changed, their health declined, their dental exams were not stellar, I began doing my research. There were many, many nights for me poring over peer-reviewed studies, listening to doctors who had put everything on the line. They trashed their reputations, everything, all because they didn't want to buy into a certain narrative. And I'm glad that I did that because I kind of got in touch with my mama bear instinct that I really had lost, I think. I am tired of hearing people tell me to follow the science with our children. There is none, absolutely none, that says that these masks are protective against this thing. You're going to hear it from all kinds of different doctors, and I question them because have they been bought off? Is there some sort of incentive? I don't really know, but it makes me concerned about that. I don't want to hear from Fauci. I don't want to hear from any of those people because he even said that pneumonia was even he said masks cause pneumonia back from COVID, before COVID was a thing. So don't expect me to follow the CDC guidelines, who have flip-flopped more times than I can count. The AAP has a huge financial backer in Pfizer, and I'm going to say that we need to stop telling them masks that don't cause harm, because facial expressions are integral to human connection, particularly young children, which are mine. They're learning how to signal fear, confusion, happiness. Covering a child's face mutes their nonverbal forms of communication and can cause emotional interactions, anxiety, and depression. And I want to ask you, how is that not damaging to my child?
Thank you, Tina.
Thank you.
My name is Pat Heil. Thank you to the board and Micah Hill. I have 4 points. One is please stay at phase 3 guidelines, keeping masks optional for the 2021-2022 school year. Second point is a board vote should be required with public comment to move VA to phase 3. And I would have to strike any lines that allow for that to be made by any other individuals other than in that fashion. No unelected public health official at any level of government should change this policy under another pretense of emergency. Emergency health scare has been used to undermine the freedoms of the citizens of the United States of America and of the Flathead Valley. It's almost guaranteed that some unelected health official, either locally or on a federal level, will try and scare the public back into masks. Very close to a guarantee. Number 3, student mental health and suicide. Students should normalize their social support and their interactions with one another. Masking decreases this level of interaction from student to student and student staff. We lost 3 Flathead Valley High School students in the last 6 months from suicide. And attempted suicide in the spring of 2021 was up dramatically. It's time to, this is according to Flathead County statistics. So it is time to normalize school activities for the health and safety of our kids and young adults. The freedom of choice with the mask is part of normalizing this interaction for our youth. And so I ask that we just go back to that. Thank you. On the flip side, no child under the age of 29 in Montana has died of COVID. And again, we're just naming just some local suicides. Optional masks. If someone wants to wear a mask, they can buy a N95 mask and wear it. These cloth masks do nothing to reduce transmission. This has been repeated in study after study. I have a number of meta-analyses in front of me of random controlled trials that have been done for decades now, and these masks are not effective for that purpose. Educate our students, including have our students be taught about the ineffectiveness of these masks. Thank you.
Thank you.
Hello, I'm Tom Pickle. I want to thank you for your service. I appreciate you guys stepping forward and serving the community. Micah, if I had known you wanted emails, I would have sent you my email opposing masks. I'm against them. I think they cause psychological damage. I think physical, there's a lot of physical. A lot of things have been discussed tonight that in terms of the detriment of mask wearing I agree with. And also, I don't think you should have the authority by yourself to make that decision. Moving forward, I think it should be put in front of the board. So I agree with all the comments that Pat just made. Very concerned about the suicides in the community. I see it, the stress level just raising, and I know it's a very difficult time. But I wanted to put my comment in there. Thank you.
Thank you. Is there anyone else who wants to make a comment? Okay. Anyone after this? We have a lot of things left on the agenda. I'd like to move this quickly.
Hi, my name is Sherilyn DeVries. I have a senior at Glacier High School, and I'm here to say again to all of you, because I haven't said it enough, thank you, thank you, thank you for last year. You all were heroes in making sure that we could stay in person. I've told you, a few of you individually, that I was one of the moms who thought, we're gonna start, and even with masks, you know, that first cold's gonna come through, all the kids are gonna be together, and everyone's gonna be home, and we're gonna be shut down again. And you pulled it off. You and the teachers, I am so impressed and so proud of all of you. Thank you for so much for giving my child a year that was as normal as possible during a pandemic. I know you're in a very tough position right now. We all wanted masks to end. We all wanted everything to go back to normal. Unfortunately, the Delta variant is here, and it is, the stats are terrifying, excuse me. Physicians are extremely worried about what's happening. People are coming in younger and sicker. A lot of the data that I was hearing from some of the other folks is data back from January or February, when we were only dealing with the original. In the last 2 weeks, there were 391 child COVID-19 cases in Montana. Children aged 0 to 19 represent 16% of the total statewide cases. Montana's 7,370 child cases per 100,000 children is significantly higher than the national average of 5,703, and that's just going to go up. I know that there's virtually no mask wearing in the valley. I understand the position that you're in. I trust that you'll make the right decision. Please put breaks in along the way so that we can mask up, so we don't have children hospitalized, intubated, and lost because of this Delta variant. Thank you so much again.
Thank you, Sherilyn. Sure.
So Devin Decker again. Micah Hill, you mentioned that 26 people emailed you for masks, 8 against. Well, I'll just count how many people were present and took the time to be here to tell you they do not want masks or want them optional. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 people showed up to express to you in person that they're against this decision or for optional masking. 2 people showed up to take their personal time to tell you that they're for it. So I think that says a lot more than an email. You know, people are tired of this. Let's get back to normal.
Okay, I don't see anyone else coming to the podium to speak, so I am going to close public comment. And what I'd like to do here is see if any of our board members would like to make a motion, and then we will have deliberation, and then we will have the vote. Okay? So is there a board member who is comfortable making a motion? Jack?
I move to approve that KPS remain in phase 3 of the pandemic operational guidelines and adopt the administration's recommendations for policy 1905.
Okay, see, when do we discuss that?
After the motion is made.
Okay.
Second that.
Thank you. It's been moved and seconded, and now deliberation. So this is just discussions, any of the questions we've had, especially in light of listening to public comment. Heather?
I would agree with a lot of the comments that are made with putting the sole responsibility on Micah, with determining whether or not to put our children back in math. I think that should be definitely up to the board. It should come to a board discussion. I think it should be like we did last year also with public comment. I think it puts too much on one individual to make that decision for our entire community, good or bad, whichever side you stay on it. And I like the idea of staying phase 3. I love all the verbiage of all of this, making it optional. But I think we should really consider the implications of placing this solely on Micah to make this decision to change.
Thank you, Heather. Jack?
I'd like to point out that line 38 underneath face coverings identifies until such time as the board of trustees can adopt an applicable district policy. That would mean that if Micah were to implement mandating face coverings, that any 2 trustees, I believe it's 2 trustees, can ask for a board meeting to address the issue. So it's stated in there that it can be addressed, and it has to be honored within that short period of time.
Thank you, Jack. Lance?
First, Mike, I'd like to just thank you for putting that out there. That's a tough stance to take. Second, I support the recommendation, and I support the way it's written, because I know on a Monday morning, things might look much different, and you're gonna have to act, and you're gonna have to consult with Sue and other people. So that will be a tough decision, and I'm sure we'll review that decision. A couple other comments I'd like to make. I know my fellow trustees. I've met quite a few of your kids that have gone to school here. I don't think you're abusive. I don't. I get emails that say it might be, but I don't think you're abusive. And I think you guys made great decisions last year to keep the kids safe as best you could. So thank you. Second of all, Montana, and this part of Montana in particular, struggles with extremely high rates of mental health issues, with chemical dependency issues, and with suicide. That was there before the pandemic. No doubt the pandemic has exacerbated that. No doubt the political system has exacerbated that. But to simplify it down to mass doesn't seem realistic.
These are complex issues. Suicide is a complex issue. So our decision tonight, it's a complex issue. And if we want to address suicides differently, we've got a mental health system that's in crisis right now. And they're working diligently on that, but there's a lot of kids that need services, masks or no masks. I support this. There's going to be more tough conversations ahead, no doubt, but this is what I think our community wants right now, is to move forward without masks. It's going to be a tough year, I think, but thank you for putting the recommendation out.
Thank you, Lance. Anybody else, any other board members?
I'd like to make, everyone knows I'm pretty quiet, but when I have something to say, Lance, that was very well said. I remember when we sat and talked about phase 3, and we really discussed it, and so I stand behind it. And Micah, you know, I know you have a lot of hard decisions. I know when you have to make them, you always ask our opinion, and you do it in email and everything else, so I have faith in that.
Thank you, Kim. Anyone else?
Call for the question.
Okay. So it has been moved and seconded that we remain in phase 3. The pandemic operational guidelines and adopt the administration's recommendations for policy 1905. All in favor, please say aye.
Aye.
Any opposed, say nay. Rebecca?
Rebecca may not be able to, there was a medical emergency where she's at.
Oh,
She sent me an email,
oh, okay,
so she's absent this vote.
okay. So motion passed unanimously with one
Absent.
absent. Okay? Thank you. Thank you. You know, it's refreshing to see public here, interested in what's going on, so thank you all for attending. I won't make you all stay for the rest of the meeting, unless you want to. And and I realized that, I forgot the construction contracts and change orders. So, is Greg still here? Come on up, Greg.
Change order. Oh, yeah, so they're doing a couple of changes.
I can talk to that.
To the elementary family. Go ahead, Mike.
Yeah, this was a change order just to reflect that there was some additional cabling needs within the project. And they actually identified these when we first presented it to the board, and then they finally came through with what the actual amount was and the quantity of cabling that was going to be needed. So those are those change orders. There is money that was allocated in the whole project, around $40,000. We were under that on the original bid, and we're still within project budget with the change order. How was that?
I like it. Okay, so this is an action item and elementary only.
I'd like to make the motion as it presented.
Thank you, Lance. Is there a second? I'll second that. Thank you, Kim. It's been moved and seconded. All in favor, please say aye.
Aye.
Any opposed? Motion passed unanimously. District-wide, Flathead High School. Are you presenting this one too, Micah, or Greg?
No, I'm gonna let Greg do this one.
Okay.
Thanks, Micah. So this is for the sophomore parking lot, I guess it's actually the junior parking lot. That I just found out, not too long ago. There was an oversight in the, wording there was a sidewalk that was supposed to be replaced. We thought it was going to be, Fifth Avenue, but evidently
Any questions from the board?
I'll just say, it's looking good over there.
Again, I walked it, the stage, the drainage was fantastic, and, they did an excellent job on the compaction and all that stuff. With that.
Great. Any, Will?
Do I move to approve as presented?
Thank you, Will. Is there a second?
Thank you. I'll second.
Heather? Thank you, Heather. It's been moved and seconded. All in favor, please say aye.
Aye.
Any opposed? Motion passed unanimously. Okay, policy updates. This is an action item. There's this is third and final reading. There's a lot of policies on here. We're going to discuss them all and then, approve or disapprove all in one motion, okay? Sound fair? Okay, who's presenting? Micah?
The moment you've all been waiting for. Third and final reading on these policies, and not to go back and read all of them line by line or even spend a lot of time with them. They were reviewed in policy committee and then again have been through, this will be the third reading. There are no changes that were suggested or brought forward, and so we're asking for the board to approve these. If you have questions on a specific policy, I'd be glad to try and answer that.
Questions from the board? Does anybody feel comfortable making the motion?
Sue, I'll make a motion that we approve the policy updates as presented.
Thank you, Scott. Is there a second?
I will second.
Thank you, Diane. It's been moved and seconded. All in favor, please say aye.
Aye.
Any opposed? Motion passes unanimously. Next one, Micah, go ahead.
Second reading of, looks like we have 5 policies that are due for second reading. Some of these are just required as a result of change in law or legal cases that have, in legal opinions. And so we're just trying to be consistent with how policies that maybe we currently had needed to be updated and changed to reflect current law. And then any questions on any of those?
Micah, could you give a brief overview of supplement, not supplant?
Yep. This is a practice that we've always had because federal funds, certain federal funds, do not allow you to supplement your budget with the federal dollars. Or they're meant to supplement but not supplant. So if we had a line item budget for, let's just say, notebooks, and then we said, well, we're not going to spend out of the general fund for that now. We're going to use this title money, these federal dollars to do that. That would be a no-no.
I see.
So it's just we've always done that. Gwen does a great job of making sure that we're always following federal spending guidelines. Otherwise, we'd have to give the money back.
Yeah, make them policy.
Yeah.
Most of them.
Any other questions or comments?
And part of it, I think, was just to give you a little background on it, was because the federal dollars in ARPA or ESSER, whatever acronym you want to use, they are available to supplant, whereas other title programs, they have not been.
Okay, so we will see those again next month for their third and final reading. So we've got the first reading, policy updates. Go ahead, Micah.
Yes. 2.5 hours, is that about what we spent in policy committee reviewing these next ones? You know, there's a lot of them in there, and again, these are based on changes in law or legal opinion or something. But there's also ones in here that are pretty exciting for our district as we contemplate a strategic plan and what can be and could be in our district. Some of the ones that I wanted to point out to you, I'm sure you all have read them, but the policies 4331, which is in reference to student clubs and organizations, they really want to create a definition and make sure that co-curricular clubs or clubs that are an extension of the classroom have a very specific designation, and then there are specific rules as to when students can use buildings for those clubs and different things like that. So just something to read over, look at, understand, and then once this policy is adopted, it will create some changes for us. Nothing to the negative, I don't think, but we just want to be sure that you're aware of that, so that as future clubs or groups want to form, that we're very clear and consistent in how we're applying the policy for those groups. The other one that I think, and probably the most exciting one for me, is the work-based learning program. Yeah, Diane's shaking her, she's like, yeah, about time.
I want to know more about that.
Yep, and this is a policy, we actually debated whether or not we should include it in this reading and move it forward. And what I would say is, we do want to continue to move it forward, but on the back end of adopting these policies, especially around work-based learning, there's going to be a lot of administrative work that's going to happen, and work with our building administrators and our teachers, and partnerships with the Chamber of Commerce and businesses and things. So this is just starting to set the groundwork for a lot of that stuff to be able to happen. So we're excited.
Any other questions? We will see that again. Okay. Next page. Consent agenda.
I move that we vote on the consent agenda.
I second that.
Okay.
Actually, we should be approving the consent.
Yeah.
Voting to approve, that's on approve.
Okay. It's been moved and seconded that we approve the consent agenda. All those in favor, please say aye.
Aye.
Any opposed? Motion is approved unanimously. The next one is our informational items and reports. So, Mark, let's start with you today.
Oh, I wanted to thank everyone for, hiring that guy over there. I think, what we saw tonight was, and his staff, by the way. Saw tonight was, a little bit well thought out. I certainly did not want to, our schedule based on, pressure of people's, time later tonight. But I'm glad that Micah got to talk when he did. So, thank you, Mike. That's my.
Thanks, Mark. Scotty?
I just gotta second that, I wanted to talk when people were here, but I didn't have my thoughts together to say it. And I don't know of a person better than Micah that cares for kids, that cares for staff. I know that the recommendation that he made today did not come lightly. I know how he struggled with that, pressures that he's under, courage that he has to make the decisions that he, in my opinion, amazing. And I personally got on this board because of Micah. For him to support the staff that we have, to two kids go through this school district. My wife teaches in this district, coached in this district. cancer in this district. I think it's an amazing place. I've interacted with many superintendents, and I get has done. Put that out there, and that is my report.
Thanks, Scott. Will?
Sue, I'd just like to say how much I appreciate you swapping the times around. It showed consideration for the people in the room. And it also showed that, we're flexible. This is a really flexible school district and board, and that was great.
Thank you, Will. Diane?
Yeah, it was just a couple months ago we were going through this. So, thank you to all of you up there. Impressive, the amount of work you've done, and wow, just thank you for your dedication.
Thanks, Diane. Ursula?
I guess what I would say is that a lot of times we have to make these decisions. And I really appreciated the effort to have the community support the kids. I think that this last year has been hard on everyone. Having a high schooler and middle schooler, those years are hard always. And I think that it is so important that the kids know that they are being supported by their entire community. And I think that when it comes to mental health issues, the most important thing for kids is to know that it does not fall all the way on them to have it together, that they have adults within their community and their family and their schools that have their back. And I'm grateful to be a part of that, but I'm grateful for all of you in the audience and watching from home. We have to all do it together. And so I just really am kind of putting an ask out there to the entire community that we keep on trying to show these kids that we are the adults, that we will work together, and that we will take care of them so that they don't have to have that on their shoulders.
Well said. Thanks, Ursula. Lance?
No report.
Heather? And I'm glad you brought your gyroscope.
I did. First, I'd like to thank the community for coming tonight and taking the time. It was just a year ago that I was here for the first time in front of you all and talking, and I know how hard that is and the courage it takes, and I thank everybody for coming tonight. Micah, I don't want you to take in any way, shape, or form the comment I made and the suggestion I made that you don't care for our students, because I know 100% where your heart is and that you love these students in this community, and you are doing your best to ensure that they are safe and they're healthy and they are in the building. So I just want to throw that out there so you know, I know where your heart is at. And now to the gyroscope. I have thought about who to pass this to, and the person that keeps coming to mind is you, Sue. You've kind of taken me under your wing. You have, you've always been there when I throw out a phone call with a question or just to talk, and I really appreciate you doing that. Like Will said tonight, I really appreciate you stepping up and reminding us to be flexible and put the community first so we could hear, and just reminding everybody that this is a partnership. You keep saying that we're rebuilding this partnership between the board and the community, and I really appreciate that. So I'm going to pass this to you, because just because you started it doesn't mean you have had it. Thank you, Heather.
Oh, gosh, now I gotta be thinking about this again.
And you
Who
can't
knows
forget it.
what I'll come up with
You have
next.
to remember it for another week now, too.
All right.
I got a spare in the car. Kim?
Basic, just to reiterate what a lot of people, all of you said, and it just kind of just shows me when I used to come to the board meetings, before I even put my name into all this, and when Mark was sitting there, and I would sit and listen to everyone, that, they all get along, they're all so flexible, and they're even laughing. This, again, tonight, your flexibility in changing the agenda, Micah, we've got your back, you know, so, you're awesome.
Thank you, Kim.
No
Jack?
comment.
My comment is I am very excited because tomorrow morning I am leaving for Helena for the very first in-person MTSBA meeting of the year. And I got the notice that with the uptick in cases, we are probably having dinner in the parking garage. So this should be very interesting. But I'm excited to finally meet these people in person. Okay. Oops, got to the right time. Administrative reports. Micah, got anything?
Let's start with Gwen.
I used all my time up there, thank you.
Okay, then we'll go with Callie.
Oh, math first.
Oh, math's first, okay.
As part of the
What-
initiation. There's been some, not so subtle hazing going around now. What I would say is, I'm new to this position, I'm new to this board, but I'm not new to the Flathead Valley. I was born and raised here. And then I've just been a stone's throw away for the last 18 years of my life. And it saddens me to see our community so divided. And, but I'm inspired by the work that I can do every day with Mike and Callie and the effort and energy they put into what I believe is a board goal, and that's community collaboration and community relations, and how sincerely Mike in particular approaches that. He gets some pretty half-baked ideas and criticisms thrown at him, and a lesser leader would be pretty critical and look at some of those things with a pretty jaundiced eye and perhaps hold a grudge based on comments that were made over the course of the last year and a half, 2 years. But he doesn't do that. You know, he responds with grace, and I think tonight's recommendation that it was missed, and maybe in some subtle criticisms by some people about the harassment issue that was in that policy, but I would encourage everybody to reread that. And one of the talking points we had was that policy applies to masking and non-masking. And the spirit in this district and the spirit that we have when we're talking about those issues is protecting all students. And what can we do to bring people back together and focus on what we do, and that's educating kids. And so that's been front and center of all of our conversations, and I'm proud to be part of the team. I'm proud to be, having those types of spirited conversations. That's good. On that note, and I'm getting long-winded, you can tell I'm not used to sitting and not talking. But we've been coming up with some plans for a virtual option, and we're pretty excited about it. And it started with this, in the idea that we need to provide an option for those students that were medically fragile or needed a reasonable accommodation. So at the elementary level, it's going to be limited capacity. We're thinking up to about 60 seats. Tomorrow morning, we're going to post, and we have prepared to post 3 halftime to 0.7. So it's going to be either from a 0.5 to a 0.7. We're still working out some of those details on 3 elementary teachers. So it'll be first, second grade combo, a third, fourth grade combo, and a fifth, sixth grade combo. Callie will talk a little bit in a second about how seventh, eighth graders can join some virtual options in high school, but there really aren't those digital academy / BYU options for elementary students. They need an actual teacher, an instructor. So we're going to roll that out. And it could be a great pilot for us to explore those types of options for a certain group of students in the future. So I'm really excited about it. I'm excited about the opportunity. And I'm eager to see what type of teacher we get to apply for that program and how we can build that and what it looks like for this year and then what it looks like for the next couple years. Lots of details. If any of you have a specific interest in that, I would love to talk to you more about the details. And as we get going, we're thinking start date would be the second week of school. So it's a pretty ambitious timeline from hiring to implementation, hopefully only missing a week or so of school. Thank you.
Thank you, Matt.
Kelly.
Thank you, Sue. Next Monday, we welcome our new certified teachers to the district. And that is a full-day orientation with the new teachers. We have approximately 35 that will be joining us on Monday. The opening session will be Matt, Mike, and I will welcome them to the district. And then they will go into each individual department. So the special ed department, the business department, the tech department, every central office department, and they will actually meet with those people for approximately an hour to get everything taken care of, all the way from getting logged into the school computer systems to making sure their insurance is good, all those little details. While they are in that session, our TEAP program will be training their mentors. We take the mentors through a formal training, and then they all come together at lunch. The KEA and the school district sponsor a lunch for our new teachers and the veteran mentors that they will be with. And then in the afternoon, our new teachers will spend the time with the KEEP directors, and they will go through their new teacher induction program. So it is a full day. It is the kickoff for their career at Kalispell Public School System. So a pretty exciting day.
How many new teachers are there?
Approximately 35. The second day, which would be Tuesday, the elementary teachers will go through training, full day of training on our elementary reading and writing curriculum. And they also have the opportunity on Wednesday, all teachers, to go to the reading conference. And this district has hosted a reading conference for years, thanks to the effort of Michelle Payne and her crew. They do a real nice job of bringing in national speakers and lots of real good training on Wednesday. Thursday, then the elementary teachers have the opportunity to go through training with the instructional coaches on Go Math. And Friday, they are free. And then that next week, there's actually no training that we run those new teachers through, and that's by design, because that gives them a week to get in their classroom, get set up, get their head wrapped around what they learned about the reading, writing, and the math. So it's a model we've been using for a couple years, and excuse me, they greatly appreciate just having that training and then being able to get in their classroom. So we're very excited and can hardly wait for Monday to start. And again, it's the start of careers for 35 people in the district. Many of them have not taught at all. We're looking forward to having them around. Matt talked about our online option. We also have one for our students that are vulnerable, may have medical situations that we need to take care of those students. And 7 through 12, we're going to go to a model where we're using BYU courses, which we did last year. We are not going to have teachers assigned and have classes remotely like we did last year, because we don't think we're going to have as many kids. We'll have a real small group of kids that will be medically vulnerable and need to have some remote instruction. We are set up. We're meeting on Thursday with all the high school, middle school administrators to make sure we're good to go on the procedures and the protocols on that. The students will not have to pay for those courses. That will come out of our ESSER 2 allocations, so we'll take care of all that. We're in good shape to make sure that they all have access to Chromebooks. Whatever they need, we're going to support. In addition, Sarah Cole is on top and going to be working closely with case managers if we have students that are on IEPs that need to access things remotely. So we think we have a good plan in place to support students that are vulnerable, but it certainly, last year, if you remember, in August, I had about 730 students enrolled in remote, and we don't anticipate that we'll come even close. I will be very surprised if I even have 30 students at the high school level in it, and that will be a high number. So, what we're hearing is our students want to be back in school, and they want to move on. And so, very exciting things. We've worked hard. We've kicked into motion our strategic plans on a lot of things, and it's been fun. It's been a good summer.
Thank you. Comment, Jack?
Questions with the 35 new hires and, how have they struggled to find housing, and how many have turned down jobs because they couldn't find housing? And what about all our new hires, administration and teachers?
And what I can speak to on the teacher piece, it was hit and miss. We had teachers that said, don't worry about it. My brother lives in Whitefish. I'm going to move in with him. And we just a lot. I know a friend that knows a friend. And then administratively, they were able to get houses. And I don't know of anyone right now that's still struggling, trying to find a place to live. Tracy Scott and her team put out a message and kept hitting the social media that if anyone knows of housing, affordable housing for teachers and administrators, please let us know. So it was kind of a group effort, Jack, and as far as I know, everybody was placed. I can also say on the other hand, we did have a couple situations where people were offered positions and had to turn them down because they couldn't find housing. And in one case, we had to go down to the fourth candidate. And it was just kind of the luck of the position, luck of the draw, luck of the candidates. It just struggled. But that was probably the worst situation that I was aware of. But everyone else seemed to find a place. So,
Thank you.
Encouraging to hear that. Thank you, Callie. We have two things left on our agenda. We have the public comment time, and then we have an executive session to discuss a personnel item. So this is the time for public comment. This is the time for comment on public matters that are not on the main agenda. Members of the audience are encouraged to briefly address the trustees on an issue that is not on the agenda. I will seek comments from the audience on significant items as they occur. Public matters do not include any pending legal matters, private personnel issues, or private student issues. Please do not attempt to address such issues at this time, or you will be ruled out of order. Please note that individuals will be given 3 minutes for public comment. So, is there anyone who cares to make public comment right now? John, go ahead. I'm not going to repeat the norms of behavior for you.
Who is signing again?
I don't think we need, no. Thank you, Sean.
Hello. Okay, it's really hot in here, and, I don't know, 76 degrees is normal, but it might help with how long this is going to be a little cooler, possibly. I don't know if that's just a standard for the 76 degrees, but, I think Scott or Mark touched on the fact that, they were appreciative of the flexibility to put item number 8 forward so that people could see. I appreciated that too. So thank you for that. In that comment, though, was the fact that you all are tired at the end. So I don't know if it is ever going to be considered to put the public comment again at the beginning of the meeting to the end, because it almost seems like you're putting it at the end because you're exhausted. And does that mean you're even listening or hearing what we're saying? I don't know. Hopefully you are. But I'll continue to request that, and I know there's probably been emails to y'all requesting that. So I'd like you to consider moving the public comment to the beginning for people. It's especially hard for parents with small children, to sit through the whole meeting, because you don't really know when the public comment's gonna be.
right now it's at, 5 minutes to 9, sometimes it's at 7:30, sometimes it's at 8:05, it's all different, so you can just show up, speak. If it was at the beginning, it'd be a lot better for everyone, every member of the public, I should say. I actually wouldn't have been able to make it tonight, so you wouldn't have had to hear me, and, that probably would have been relief for some of you, because I don't think you like listening to me. But, anyway, being in phase 3 is great. I'm glad that we're in phase 3. I do worry about the fact that Micah can, decide to change that. As Lance said, it could be, Monday could come along and then we could be in max. So, hopefully that doesn't just happen, because he kind of alluded to it, possibly. I don't know what he meant by that comment, but I certainly hope it just doesn't become masks overnight, without a vote or anything like that, because that would really upset the public. And then the remote learning you're talking about doing, I certainly hope that you open that remote learning back up to larger numbers if you do consider putting masks back on kids, because the reason people want to be back in school is because you're in phase 3. If you go back to masks, there's a lot of people, including my children, who have medical notes and couldn't attend school unless they wore a mask, even though provided a medical note. So I guess that's about all I have to say. Thanks for your time, and please consider my comments.
Thank you, Sean. So let's take a 5-minute recess, and then we will reconvene into executive session with just board and administrative personnel. Okay? Thank you, everybody, for attending, by the way.
I got hooked on this drama, episodes, that's all I did all week. Binge watch. Binge watch.
Which one?
Oh, called Black.
No, I don't know that one.
Yeah, so my sleep time.
Yeah.
Oh.
And it just automatically starts the next episode. It is bad.
But it's also really.
It's really good, but it's really, really bad. It's much better for us when we had to wait a week.
Oh my God, can you imagine?
Or the whole season.
Oh, yeah. With they do the cliffhanger. Yeah. Like. I never was that. And then you're trying to remember, what was the last episode like?
So they would show you that, the recap, yeah. Back then. So you would actually go outside and do something to hide. That's in spot.
Yeah.
Don't worry, they're not the other one.
Thank you.
And they waited.
So, is Jason?